Listo?
Sí, señor.
Welcome to the office. So you're coming from San Jose. You got a few things going on. We've already done the consultation. We're going straight into the exam and the adjustment today, okay? And you came here for what? If you can at least describe, why are you here?
Because I have a lot of pain on my left lower back.
Yeah.
And my old left leg.
Yeah.
And then I can walk for more than 2 minutes.
So you're coming here, you have left low back pain, hip pain. You got pain coming down your leg. We saw that the left leg, the musculature is a little bit less than the right side. Yeah? I want to just briefly go over the x-ray and start the exam. Is that okay? All right, let's get started. He has a rotated sacrum on the left side with an ASEX pelvis. So basically what's happening on the left side, the left pelvis goes up and out and the sacrum on the left comes out. So there's a disconnect, sir. Yeah? There's a disconnect in that left side. That's number one. Number two, we talked about there's a bend in the sacrum here. The sacrum bends to the left side. And we can see it on this x-ray, the nubs, right here and right here. So S3 is where all this is starting. Rotated sacrum and the pelvis. From there, we did the level foundation principle, and we found L4 as a potential, T12, 7, and T1. There is something going on in the upper cervical we're going to address, we're going to look at, based on a couple of other findings that we see. Now, what's most important, okay? These are all just x-ray findings, sir. The most important thing is figuring out which one is causing your pain, okay? And you do a lot of heavy work. Got to get you working again and playing soccer again, right?
Yep.
Okay. If we're looking at the dimples and what are we seeing here? His left pelvis, his pelvis wants to go to the right side. But if we look at his feet, both his feet are externally rotated. And I had asked him, I said, is that something you've been doing for a while? He said, as long as you can remember, right?
Yep.
And whenever I see that, I'm always thinking something in the upper cervical as well. So let's watch him walk and see what we see first. All right. And regular walking back and forth, please, sir. So you can see he walks on his back of both heels when he steps. And you can see the shift. So when he's moving the pelvis, the right side moves, the left kind of shifts when he moves. So watch the left side here, and what you'll see, go ahead and walk. Instead of doing this, it's shifting left side. So the right one goes up. As it's coming down, it's causing a shift in the left SI joint. And that's the fixation. Have a seat, sir, and let's go ahead and examine you. Starting at the base of the neck. All right. And the first thing we're getting, we got a 10-pointer, but it didn't stop. It keeps going. And that's important. When we're looking for the break, we want it to come back to 0. It didn't stop. It keeps going all the way to the left side. Looks like it's going to break there. Nope. Goes to the right. Nope. Goes to the left. Boom. You had an old fall. Mama, call your mama, or somebody dropped you when you were a kid. All right. Now from the base of the neck down, next thing we're getting, T3, 10 points, left side. How long was your drive, sir?
Around 6 hours.
Okay. T12. 10 points, T12. And all of this is a function of down in the low, S3. S3, T12, T3, and C1 occiput potential. Scoot forward, sir. Let's check the motion of the pelvis. Feet together. Open and close your knees, please. Open and close. Good. Right side only. Good. So when he does the right, there's a whole shifting of the left side. Left side only. When he does the left, the right stays put. So this is left SI joint. Sit back for me, sir. Let's go ahead and let's statically palpate, okay? Head down. right. So you can see right there the orange peel starts. This whole thing is swollen right there. Número 3. You can see the orange peel continues all the way down. It starts to get more swollen there, and it goes into 12. ¿Duele? 1, 2, 3. 1, 2, 3 or 4.
4.
3, 4. 5, no, 4.
4.
4, 12. Para al frente. Go forward, please. Sit up straight, sir. So he can't even sit up straight. He has his car. I need you to sit like this, sir. This is your normal, but like when he does that, you can see that kink coming at 12. So it'll be interesting to see after the adjustment what happens. Sit back for me, please, sir. Okay. Now, número 5, come back. Número 5. S1.
Poquito.
S2.
Nada.
S3.
Poquito.
Is there. Is deep. Is deep. That's old, man. Come back towards me. See?
Sí.
3 or 2?
3.
2 or 1?
Poquito.
1
Poquito.
or 5?
5.
But 5 we can't do without S3. ¿Entiendes?
Sí.
Okay. Well. So we have, I know, you're going to be okay, sir, don't worry. S3, T12, T4, and let's check up top. Sit back for me, sir. Let's check here. C7, C6, 5, 4, 3, 2. Bueno. Número 1, left side. Turn your head to the left, turn your head to the right. Look up, we're isolating the lower cervical, and down. Look down, isolating the upper. All right, so we have an ASLA, Atlas, we have a T4, we have a T12, and we have a sacrum and pelvis. So here's what I'm going to do with you, sir. Here's my thought process, okay? I said we need to do up top messages, and we need to do foundation. So we got to fix the penthouse and the basement.
Okay.
Then I'm going to have you walk. After that, we'll retest and see what we're going to do.
Okay.
Does that sound okay?
Sí, señor.
¿Listo?
Sí.
Bueno. Boca abajo, por favor. You know, it's a big deal. This guy drove 6 hours. It's a really big deal, you know, in terms of he's going through a lot. But what's even more important than that is he should have somebody near him, and he should have access and know that there's somebody near where he lives, where you guys live, to help. Okay? Okay, señor? Turn your head to the left side, please. Bueno. Left mano aquí. ASLA, so we got to be in the front of it like that. Poquito. Poquito. Bueno, gotcha. Hold on. Head down, please. Okay. Senora, come help me. Hold his ankles here, please. Like this. Okay. Go up a little bit, sir. Up. S3. Senor, I'm not going to hurt you, okay? All right. S3. Let's try that again. L5, S1, S2, S3. S3, and we want to torque slightly the tilt is on the right side, so we want to torque clockwise. Poquito, señor. Gotcha. Step away, man. Back. He's actually tougher than he looks in terms of the spine. That was a little bit. Come off slowly, hold my hand, please. And let's walk. Walk back and forth several times, please. Just regular walking, okay? Regular walking. Now, I want a little more of that atlas still. Have a seat over here, please. Let's get a tiny bit more. Sit back all the way. Left ear down. There you go. That's the home run. Stand up and walk out, please. One second. Uh-huh. Qué diferente.
See?
You notice that that foot you were swinging is starting to hit the ground now. You're walking different. It's hitting different. Keep walking. Sí.
Sí, señor.
Siéntate aquí, por favor. But there wasn't a big crack in the low back, was there?
A little bit.
Little bit. It wasn't a big one.
No?
No. But it doesn't need to be. Already, mira. Siéntate recto, por favor. Mira. It's easier to sit like this?
Yep.
Cool. Bueno. Let's continue. Sit whatever's natural right now. Still better. Good. Starting at the base of the neck. Atlas is clear. You see what it did here now? T4 is clear. And it doesn't mean we're not going to do it, or maybe do it next time. I don't know yet. But look what happened. T4 and T12 clear, man. Perfecto. Cero. Mira. Siéntate recto. Mira. Okay. Sacrum. S1 bueno.
Sí.
S2.
Sí.
S3.
Sí.
Un momento. 5.
Nada.
I didn't touch 5. Pressure only from my finger. See?
Mm-hmm.
Pretty cool.
Yeah.
5.
No.
Sacrum.
Nada.
S2.
It's okay.
S3. Fantastic. Bueno. Can I continue, sir?
Sí, señor.
Ears. Come a little closer.
Ay, ay, ay. Ay.
Para, para, para. All right. Sit up straight. There you go. On your back, boca arriba. So you said you sprained some ankle, right?
Yep.
I fixed for you. So what he was telling me, he fractured his right fibula. You can come over here, you can see this. Slide down. Poquito más. Bueno. So what we can see here is this is kind of, he fractured it. It remodeled compared to this side. Now, what I'm checking is the talus. Okay, the talus is the keystone bone of the foot. And I'm feeling the medial aspect here. And the way we're going to test the movement is we want to do dorsiflexion. The side that doesn't move back the most is the one we're going to work on for today. Okay? Señor, I want you to bring your feet back like this. Bueno, as far back as you can. Keep going. So they're both kind of stuck, right? This one's busted here, so it's more flat. So this whole thing is stuck. On this side, it's tilting. Relax. It's tilting on the inside. So we have an AS talus medial tilt here, and we have a total AS talus going across there. Okay? Now, which one? This is the old one over here. This is the new one, right?
Yep.
I would like to see the x-ray of this right foot before I touch it. Okay, you have an x-ray on this somewhere?
No, that happened like 20 years ago.
Okay. We're still going to need an x-ray on it next time, okay? If you want to do it right. So I don't want to mess with this one. It's okay. It's already fused up. But I want to see, do we have joint space there? If there's joint space there, then I can actually do something for you.
Okay.
If it's all fused up, there's nothing for me to do there.
Okay.
But this one, yes. Okay? Now, you ever seen your husband cry? You see him cry? Okay.
No.
Let's see what happens. You may need to hold his hand today. Now, what I'm doing here, sir, lotion. I have to break up the scar tissue first, okay? And I'm just using... Slide down a little more, sir. You've never seen him cry before, right? This is all scar tissue. Ba-da-ba-da-ba-da. You feel all that. That's all scar tissue, sir. Okay? If I don't do this, I don't fix nothing. Okay? 5, 4, 3, 2, 1. Now, passive range of motion. A little closer. And I'm my web contact across the dome of the talus, dorsiflex, and it's crunchy in there. Dorsiflex, dorsi. It's crunchy, senor.
Sí.
4, 3, 2, 1. AS talus right here. AS talus, medial tilt. There we go. And that's the home run, sir. Okay. Stand up for me. Let's walk. And as you're walking, tell us the difference, please, if anything. Butt up. It's gonna feel a little weird, sir. You've been used to walking off balance. Caminar.
Mucho caminar.
Mucho. Walk on your toes, please. On your toes, high. It's okay?
Yep.
See. Turn around, walk on your heels, please. This is a good test. Left side, no duele. Caminar. Now, why don't you tell us what's different in your walk in your backs from before your adjustment?
I don't feel anything right now.
What do you mean?
I don't feel any pain right here. And before I feel something.
Okay. Okay. Walk one more time, please, and then I'm going to do another test. Señora, mejor. Siéntate aquí. Sit on the floor, please. Now, Señora, you tell me what's different here. You come over. What I want you to tell me, I'm going to have your husband get up fast.
Okay.
Come on. Stand up fast. Is that different?
Mm-hmm.
What's different?
He can move fast.
A little easier now, right?
Mm-hmm.
Awesome. Walk one more time and back.
Mucho rápido.
Rapido.
So now I can fly.
You're not playing soccer yet, dude. Have a seat over here, please. Let's rescope. Look how he's sitting now. And look at the musculature. It's more even now, more symmetrical. Not 100%, but it is more symmetrical. And we didn't do any muscle work for you, did we? The penthouse is clear. Now, I am getting a little flutter there, but that's not a reading for me. Same thing here. 12 is also clear. All right. All clear. Senor, let's check your hands. Stand up for me. Aprieta. Aprieta. You lefty or righty?
Right.
Squeeze. Squeeze. Poquito. Squeeze. Right here, just a tiny bit scaphoid. Can you relax there for me? Squeeze. There you go. Squeeze. Any questions, my friend?
No, señor.
You understand what I found?
Yeah.
You understand the process?
Sí, señor.
Okay, welcome to the office.
Thank you.
You're welcome.